Well, when it comes to nail care, with a patient that has diabetes, now it depends if they have neuropathy, if they have poor circulation, and if they're able to control their diabetes. A lot of times, someone that has diabetes might develop thick, discolored, and brittle nails. The the dangerous things about this is that a thick, discolored nail could also add pressure to your toes. So once you start seeing your nail becoming thicker, it's always a good thing to, cut your nail to a point where there's not pressure added to your toes. A lot of times this could be anywhere from a monthly cut to every 2 months. What I do to my patients is I see them at least every 3 to 4 months to cut their nails, and most of the time the nails, most of the time depending on the patient, they might be seen earlier than 3 months. But also to take into consideration is the blood flow. A lot patients that have diabetes do have poor circulation, and poor circulation sometimes prevents your nails from growing as they should. They become thinner. So a lot of times, you don't want to, you don't have to cut your nails as frequently as you should. The way you should cut your toenails, depending on the structure, is a normal toenail. You should try to cut it straight and allow the edges of your nails to at least grow out of your skin, and this will prevent a lot of times ingrown toenails. And that's important, especially in patients that have diabetes, to prevent any type of infection. However, if you do have a nail that's thick and discolored or looks like a fungal nail, it's just important to have someone either cut them for you or go see a podiatrist or someone who specializes in the debridement of nails to cut the nails for you. Because a lot of times, even if you cut your nails successfully, you might, there may be areas that are sharp, or it might not, or the nail might still be very thick, which could lead to a cut or pressure added. So it depends. Usually, I would say maybe every month or so you should cut your nails every 3 months, depending on what you see in your feet. You should examine your feet every day. If you start noticing, things that might add pressure to your toes, or or a nail might be getting ingrown, this is it's a good idea to act on that fast enough to prevent any type of infections.